Everyone knows that smoking is not good in pregnancy. I heard the story of a little girl who was in a salon with her mom, and she saw another woman who came to do her hair but was pregnant, and this woman was smoking. And this little girl walked up to that woman and said, "You shouldn't be smoking because you're pregnant." And this was a little girl. So everyone knows that. And in fact, the Royal College of Obstetricians and Gynecologists of the UK has highlighted that smoking during pregnancy increases the risk of a child developing behavioral problems, including ADHD. This is because smoking reduces the amount of oxygen and nutrients that can pass through the placenta, and this affects your baby's brain development. But did you know that there are other factors apart from smoking? Please stay tuned and we'll be discussing all that. Welcome to my channel. My name is Dr. Adeze Ifezulike. So, you might be watching this because you're ready to have a baby. You're ready to start planning for pregnancy, or you may already be pregnant. Congratulations on being pregnant if you are. Now, there are key risk factors for ADHD in pregnancy. These factors can make you have a child that has ADHD. Sometimes you might do all you can, so even though we're discussing these factors, be mindful that you may avoid all this and still have a child with ADHD. But the reason we do this awareness is so that you can do your own bit to reduce your chances of having a child with ADHD. And the fact that someone you know has a child with ADHD doesn't mean she was doing these things we're going to talk about, okay? Because there are still differences in opinion about how ADHD comes about, but we'll also look at some research papers, and then you can make an informed decision that hopefully will help you in your pregnancy. So the very first risk factor is smoking. Exposure to tobacco smoke during pregnancy is linked to a higher risk of ADHD in children. Honestly, if you're pregnant and smoking, I encourage you very strongly to stop smoking. Go to your doctor, ask for nicotine replacement therapy. These are medications that contain nicotine, so the same substance in your cigarette, but it doesn't have the toxic substances in the actual cigarettes, okay? So these medications are called nicotine replacement therapies. So if you're smoking and you're struggling to stop, go and get them. It's really safer for your baby. So smoking is a risk factor for having a child with ADHD. And it's not just you smoking, but secondhand smoking, also called passive smoking, also contributes. Even if you don't smoke, being around others who do can increase your risk. So you need to look at people around you, let them know, "I'm pregnant. Please, my good friends, if you appreciate me, if you call me a friend, please help me keep this beautiful life growing inside of me free, so that you're not having to inhale the smoke that others are smoking." Okay, so secondhand or passive smoking can also contribute to the risk of having a child with ADHD. The next risk factor is alcohol and drug use. Substance use during pregnancy, whether you're using cocaine, ecstasy, marijuana, crack, all those different things, they all put your baby at risk and affect the brain development of your child. You want to have a healthy child. I'm sure you want to have a healthy child. That's why you've chosen to become a mother. So why not give your baby the best environment it can grow in? Why not stop using these street drugs? Please go and get help if you're struggling, because we know it can be an addiction. Sometimes you want to stop using them, but you're struggling to. So please get help. But don't take them because you're simply soaking your child in an environment of these drugs, and it's not good for the child. The next risk factor is high stress levels. Chronic stress may affect your baby's neurological development. I think stress is the one that many people don't know about. I see pregnant women and they're very upset about one thing or the other. They are so overwhelmed by one stress or the other. I'm telling you, if you're pregnant, do all you can to manage your stress. That is the time you want to be as chilled as possible. Even if someone is provoking you, they are trying to get you upset, just ignore them. Why? Listen carefully. When you are pregnant and you're stressed, you're releasing a lot of stress hormone. And that means you're bathing your baby. You're soaking your baby in stress hormones. The baby is not meant to be exposed to that amount of stress hormone. You're laying up trouble for that child. You want to have a healthy child, not one that comes out very jittery, anxious, prone to depression, or have one neurological deficit or the other. You want to do what is best for your child. That's why you chose to be a mother. So I encourage you, if you're under stress and you're pregnant, you might be putting your child at risk of having ADHD. So please manage your stress. Be as chilled. All the stress management tips you've heard of, this is the time to apply them. Pregnant women, you need to be chilled so that your baby is developing in an environment that is not polluted by stress hormones. The next risk factor is poor nutrition. If you're not taking enough essential nutrients, that can affect your baby's brain development. All pregnant women should have a good idea of nutrition. Please educate yourself. Find out what it means to have a healthy meal. A healthy meal essentially composes of your good protein, your good fats, and lots of vegetable. These three things, once they are there, that's fine. Then you can add on other things later on. So make sure your meals are composed of lots of vegetable. They can be leafy greens, they can be broccoli, carrot, peas, lots and lots of colorful vegetables are really healthy. Then add on your protein. Your protein might be your eggs, it might be your meat or your fish, whatever protein you enjoy, add that on, but make sure it is real protein. Not just the processed bacon, processed sausages, those things, there's hardly much nutrients in them. And then healthy fats. So things like avocado is very good. Things like some nuts, you may be someone who enjoys nuts. Your oily fish, your mackerel, and so on. Those are really good fats you can use as well. And then reduce your intake of carbohydrates. If you're pregnant, your baby doesn't need a lot of calories. That's a misconception. I remember back home, they would tell you to eat and eat and eat because you're eating for two. Please, that is a misconception. Your baby doesn't need that much. It needs you to eat healthily rather than eat heavily. There's a difference. You need to eat food that is rich in nutrients, lots of vegetables. Ensure you have some fruits as well, but don't overdo it, okay? So your vegetables, your protein, your good fats, and some fruits, perfect. Eat healthy meals that will also contribute to nutrients that can go to the baby to help it in its brain development. So now we're going to talk about some papers, some research paper that have addressed these factors that can put people at risk of having a child with ADHD. There was a systematic review and meta-analysis of prenatal birth and postnatal factors associated with ADHD in children. The authors were Sullivan et al. It was published in the Journal of Attention Disorders in 2022, so relatively current paper. And summary, this comprehensive meta-analysis reviewed 69 studies to identify modifiable factors during pregnancy and early life that are associated with an increased risk of ADHD in children. So their key findings were prenatal factors such as maternal obesity before pregnancy, preeclampsia, pregnancy complications such as placenta abruption, elevated prenatal testosterone exposure. Postnatal factors were things like low APGAR score when the child was born, neonatal illness requiring intensive care, and lack of breastfeeding. So these were some of the factors they looked at. So the ones you can do before the child is born is make sure you're the right weight for your height. So work on tackling obesity before you become pregnant. Because obesity from this study can predispose to a child having ADHD. Preeclampsia is another factor they mentioned. In this situation, there's high blood pressure, you might be leaking protein into your urine, and so on. So really important to manage any history of high blood pressure before you even get pregnant, and make sure your blood pressure is checked throughout pregnancy. The other point I want to mention is they said lack of breastfeeding can also predispose. Obviously, not every woman finds it easy to breastfeed, but as much as you can, try and breastfeed your child. This paper says that might be a contributing factor. So let's look at another paper. This one is pregnancy-related maternal risk factors of attention deficit hyperactivity disorder, a case control study. And the authors were Mohammadi et al., and it was published in ISRN Pediatrics in 2012. So it's an older paper. And in summary, this case control study compared 164 children diagnosed with ADHD to 166 control children to identify the maternal risk factors during pregnancy. So significant associations were found, okay? I want you to take note of that word. It says association. It doesn't mean a caused it. It just means that these factors were associated with the moms that then had a child with ADHD. So there's a difference between causation, something definitely caused something, and something was associated. We found it in these women that had children that have ADHD. So let's look at those factors. So the first significant association they found was maternal disease or illness during pregnancy. And examples are things like diabetes, like hypertension, like asthma, thyroid disorders, autoimmune diseases, heart disease, kidney disease, infections like HIV and hepatitis B. Now remember, it's just association. So these diseases can increase the risk of complications during pregnancy, poor fetal development and growth. The child may need special delivery care. There may be postpartum complications. Now, the other thing they found out was there's an association with maternal psychiatric disorder. So if the mom has a psychiatric disorder, it might contribute to the child having ADHD. The other association, as we already know, they found is exposure to alcohol and cigarette smoking during pregnancy. Then there was an association with cesarean section delivery, an association with abdominal trauma during pregnancy. So if there was an injury to the pregnancy, to the tummy during pregnancy. So these studies show the importance of maternal health and lifestyle choices during pregnancy. Pregnancy is a high-risk state because you're bringing in another human being into the world. So it's really important to do all you can. First of all, before you're even pregnant, try to be in the best health possible for you. Try and get to your right weight. Try and learn to eat healthily, learn to exercise, manage any blood pressure problems you have, check your thyroid, be in the best shape you can before the pregnancy. And then during the pregnancy, like we've seen, things like smoking, like alcohol, like any sort of ill health that comes up, please don't sit on it. These things have to be tackled because what we're trying to do is to bring forth a child who is healthy and well in every way possible, as much as lies in our hands. Remember, these are associations. We don't know if they truly cause ADHD or other neurodevelopmental disorders, but they have been found to be strongly linked. So really important to do what we can to be healthy before we aim for pregnancy. And then during the pregnancy, for me, the key one there is stress. Manage your stress. Life is stressful, but you're doing an important work, bringing in a life into this world. So you have to do what you can to make sure you're not bothered by things, to make sure you're not getting stressed. I know it's easier said than done, but as we can see, stress has been implicated in having a child with ADHD. So do what you can to avoid being stressed as much as lies in your power. Your stressor may be due to your type of personality. If you're the kind of person who is easily bothered by things, or you don't let go easily, you get upset easily, all that you may need to work on even before you head towards pregnancy. So I hope this has been helpful. If you're pregnant, I wish you every success. If you're struggling in any way, please reach out. Type into the chat. Are there things you think need to be sorted during pregnancy? Maybe some cultural things we believe, like I mentioned about overeating. I remember when back home in my home country, when you're pregnant, they'll want you to drink pap. to eat and eat and eat and eat. There's that belief that the baby needs a lot of food, but your baby doesn't actually. It doesn't need much. And you can imagine when the baby comes out, it's just sometimes 2.5 kg. So one small thing doesn't need all that food. But what it does need is healthy food. Okay, so you need to eat lots of healthy food, okay, for you and the baby. But please don't just eat for eating's sake. Eat to nourish that life growing inside of you. Eat with the aim of bringing forth a healthy child, and you'll be glad you did. So I hope this was useful. We'll continue on the ADHD series. If you have any questions about ADHD, please type in the chat. I may have covered this in the other videos, but if not, I will do a video on it. Till we see next time, take good care. Subscribe to the channel. Bye for now.